One of the single most common problems that parents encounter and talk about is teething. And I'm going to talk about teething because it often is misconstrued as a disease. Parents often think that teething causes a lot of medical symptoms, and as a result, they delay coming in and getting help for a legitimate medical problem. Now, I'm going to apologize in advance. There might be lots of grannies and gogos that might disagree with me, because often parents will say, I spoke to my mum and she says it's probably teething. There's nothing to worry about. So is teething a problem that makes your child sick, or is it an illness? And is it associated with fever? Now, for every parent, right from birth, they're looking forward to the milestones that a child is developing. They're looking forward to when their child rolls, starts to crawl and sit. And round about 6 months, children start to develop teeth. And remember, this is the age at which children start to have to develop their own immune systems. The antibodies that their mother gave them during pregnancy reach their sell-by date, and they start to have to develop their own antibodies. And this coincides with the same time at which children get teeth. So children often have older siblings that get sick and children start to pick up colds and flu and symptoms, and they're getting teeth at the same time. And this is misconstrued as a problem of teething. I mean, think about it. It is no different from saying when a child starts to sit, it causes a temperature. It is like saying when a child starts to crawl, they start to get a runny nose and start to get a fever. This is absolutely no different from when a child reaches 6 months. So, when does a child have teething symptoms and when is it a proper illness? A child is going to become a little bit more crankier than normal. You might find and notice they're a lot more fussy, not wanting to be held and comforted as often. They are kind of fussy, they say drooling a lot. They have mucousy drool from their face. They develop a little bit of a rash. They're gnawing on things, wanting to chew on things. And yes, these are typical symptoms of teething. Your child might have a little bit of a cough, a little bit of a runny nose, and these are symptoms that parents associate with teething. They've actually done research and looked at children developing their teeth, following them up and measuring their temperatures. And in fact, there is no association. A child is not going to develop a high fever of 38 degrees when they are teething. So if your child is developing symptoms that resemble more colds, flu, coughing, snoring at night, not eating, those are definitely not symptoms of teething. A child might become slightly disinterested in eating when they start to teeth, but they're not going to go completely off their food. So let me try and describe the symptoms that would distinguish when a child is really ill. So the difference between a child that is teething and not, they have very high fevers. A child having fevers over 38 degrees is most definitely more in keeping with an illness. And when they lose the appetite, not wanting to drink and eat, these are not common symptoms with teeth. And just think about when your child has their first tooth, and a couple of months later, when they're cutting teeth again, think back, did they really have a problem with that first tooth? And remember that particular first tooth and say, look, they didn't really have any symptoms, and remind yourself that this is something different. And as I said, if a child's vomiting and has diarrhea, that certainly is not teething. They might have maybe a little bit of acidic poo in a stool that might cause a little bit of a rash, but that is something temporary that lasts a couple of days. So, the treatment of teething is very different from the treatment of a medical illness. So I'm going to just put that across to you and just ask you to think about it and help you respond to a genuine medical problem. Children, when they teethe, they have nerves that go from the bottom jaw and the top jaw called the trigeminal nerve that give you sensation in the upper and lower gums. And these nerves travel through to the brain through the middle ear. So when those teeth start to erupt, they can cause a bit of irritation and referred pain. In other words, the child starts to rub their ears. Rubbing of the ears is not necessarily an ear infection. A child often has a runny nose and a cold at the same time as having a middle ear infection. And if you are worried, remember a pediatrician can look at that and help you and assist you, and literally within a few minutes distinguish the two problems. And I hope this helps.